Today in public health.
The only thing that I can see is going to happen as a result of the announcement from today is an injection of greater amounts of uncertainty and fear and confusion where there doesn't need to be any of that.
We need to talk about child vaccines, and I already know people about to jump in the comments and just start stretching their fingers to just type up some BS. But hear me out before we start fighting. President Trump recently signed an executive order that changes the direction of childhood vaccination and with the stated goal of maximizing parental choice. And to be fair, I understand why the phrase parental choice appeals to people. I'm a parent. I absolutely believe parents should have the right to ask questions about what goes into their children's bodies, but we should be able to ask questions. Talk to your healthcare provider, understand what you're consenting to. I'm all for that, 100%. But here's where public health side of me gets concerned. According to the executive order, the number of vaccines routinely recommended for a child has gone from 18 to 11. Vaccines like hepatitis A, hepatitis B, rotavirus, meningococcal disease, influenza, and COVID are among those that will be no longer recommended for every child under this approach. So just to be clear, the executive order does not ban these vaccines. The order does not immediately eliminate state vaccine requirements, but the vaccine policy shift may undermine childhood immunizations and maybe cause an outbreak. And that's why this is important. Don't run to Facebook saying that, hey, Silverback said the government banned vaccines. No, I did not say that. Another major change involves MMR, the measles, mumps, and rubella vaccine. The order calls for those vaccines to eventually be given separately once individual products become available and encourages separate visits for each of those vaccines. And this is where the policy becomes more than a political argument. It becomes a public health question. Vaccination doesn't only affect the person getting vaccinated. When enough people are protected, diseases have fewer opportunities to spread, which also helps babies, people with weakened immune systems, and other people who can't fully be vaccinated. Measles is a perfect example. Preventing sustained measles transmission generally requires around 95% of the population to receive 2 doses. And kindergarten MMR coverage in the United States is already below the level nationally. So when vaccine rates start dropping, measles really just sitting over there in the corner of the club like, hey, so you think I got a chance? There's another practical problem though. More appointments create more opportunities for people to simply not come back. An article from Required Time states that splitting the MMR into separate appointments can create delays and reduce completion of the vaccine series. It also states that there's no credible evidence that separating measles, mumps, and rubella vaccination is safer than giving a combined MMR vaccine. And that's something that we have to think about at a population